And now, without further ado, I would like to introduce our next speaker and move to session that will be talking about putting longevity medicine into the public sector, putting longevity medicine departments into the university hospitals. And I am extremely happy to welcome our first speaker, Professor Tzipora Strauss from Sheba Medical Center in Israel, Tel Aviv. Thank you for being here. She's the head of neonatology department, so almost at the bottom of longevity medicine starting of our lifespan, and also the director of Sheba Longevity Department. Yeah, Tzipi.
Okay, so thank you for having me here. I want to start with, actually I echo with Nir Barzilai and Michael Ringer, who say that we as physicians are a little bit skeptical. And also as human beings, we are not always think that we can do something to change, and we are skeptical human beings. So trying to bring longevity, healthy longevity to hospital, a public hospital, raised a lot of brows and some kind of skepticism from, of course, my fellow physicians. And my CEO, who was really for it, said, Tzipi, if you have an idea and everybody say, very good, the idea is bad. If you have an idea and many people say it will not work, forget about it, it's too difficult, you are on the right track. So I'm happy to be on the right track. And luckily, we are opening the first healthy longevity department in a public hospital, and in academic hospital. And we launch our department in May, which was an amazing conference. Many of you were here, were there. We got great international coverage in social media, Forbes, Jerusalem Post. Nir also mentioned we had a lot of interesting drama there, but it was a really great conference, and hopefully many of you will also come next year. So our center, our department, longevity department in our hospital is composed from 3 different arms. We have the clinical arm, the research arm, and the innovation arm. We already started, as I mentioned, in May, to gather our longevity cohort. We in Sheba have, since the 90s, an executive screening program, which healthy individuals are coming. We have a lot of data on them. We started to gather their data, individuals that we have their data from 1919 when they are 40 years old, and then we follow them. They actually come every year to do the same screening, and it's a lot of blood check and cardiac function, respiratory, and a lot of data on them. And we follow them for 23 years until today. We correlate that with the Israeli Health Ministry, that we have mortality rate cause, hospitalization days, cancer and stroke registry, and our aim is, of course, it's a retrospective study, but our aim is to find the relationship between biological age, morbidity, and mortality. So this is our first retrospective study that already been collected. Now, for the prospective study for our center, our vision for our Sheba Longevity Center clinic is evidence-based, personalized medicine, and in order to promote health, maintain and improve physical, mental, and cognitive performances. And we are going to focus on what we call the 4 A's. And we think that as a longevity department in a hospital, it must have these 4 A's. And what are they? The first A is accessibility. Longevity needs to be accessible for all. And that's why we are in a public facility. everybody can come. This is the first A, accessibility. The second, which is very, very important, it must be affordable. Okay, we want to have healthy longevity for all. We physicians, we want everybody to have healthy lifespan. So, and just for you to mention, in 2023, 2024, we are going to have all our clients free of charge. All the studies we will do will be completely free. So it is, of course, affordable. The third A is academic. We have to have longevity that will be credible and validate. And we in Sheba, we are affiliated to Tel Aviv University, which is, of course, and we are academic hospital. So all our data, all our questionnaires, all our diagnostic and assessment, of course, are recognized and validate that we can all share it in journals and be replicated in different areas all over. And of course, the last 4A is AI-driven. We all talk about it all the time. We have tons of data on different, from one patient, and we need to understand all the different algorithms. We did have a data lake that we built. It contains also the retrospective data for the last 20 years of an individual and, of course, prospective data. And in order to try to understand cause and effect, to build trajectories, etc. So in order to have these 4 A's, and to make sure that we are aligned with them, we needed to have a very good board, a medical board, that will help us to be in tune with that 4 A's. So I'm happy to have our executive medical board. Many of you are, of course, here in the audience. We already had the first Zoom meeting in summer and talked about, of course, our method, our studies, and how we are going to do our longevity department. So our first study that we started already to enroll is our SHARP study. SHARP study is a synonym for Sheba Healthy Aging Research Population. Our aim in 2023-2024 is to have 1,500 individuals. We already have started to register. We first, of course, went to our pre-screening clinic, which we, as I mentioned, have 20 years of data on them, so we continue to have them prospectively. Of course, social media, any other referral from general practitioner, and of course, any individual that wants to, interested individual that wants to come will be registered. We do a pre-screening with the very basic inclusion criteria, which is you have to be above 50 years old. And the exclusion criteria that you don't have an acute illness at the time of the assessment, or you are or the individual is undergo chemotherapy or radiation. And then we schedule the first visit. In the first visit, of course, there is an informed consent and 4 or 5 hours of extensive assessment protocol. What is our protocol? So in this first visit, the protocol contains biological age clocks. We take multiple tissues for biobank, body composition, locomotion, strength, balance, a lot of questionnaires regarding lifestyle, nutrition, quality of life questionnaire, as mentioned before, psychology and cognition assessment, sensorial assessment, women-men health, microbiome, and system-oriented cardiovascular, respiratory, liver function, kidney function, etc. So after this full day of assessment, we do randomization. The randomization will have our study group and the control group. The study group will get the intervention plan, which I will explain in a minute. The control group just got the assessment, and that's it. In the intervention, we are planning to intervene in 4 specific areas, which we thought that they are related and influence healthy lifespan. So the 4 areas will be cognition and mental, sleep problems, sarcopenia, frailty, and menopause and andropause. Each of the individual from our study group will have what we call a SLAP, which is Sheba Longevity App. This is a home-made application that was developed in Sheba. And this app, first of all, will show a dashboard, of course, of all the different measurements and diagnostic that the patient got. It will get, of course, the intervention, the task, the mission. It is connected to different wearables, and we will get a subjective and objective. We ask also questions and graphs and the individual pace of how is he doing. So after 6 months, both intervention, the study group, and the control group will come to a visit only for a blood sample. And then after 6 months from there, so it's 12 months from the first diagnostic, the whole cohort, the study and the control group will do a second assessment, which will actually repeat the first assessment that they did a year before. And our primary objective is to see whether there was improvement in the study group compared to the control group because of the intervention, whether there were improvement in measurable outcomes such as performance, biological age, etc. So this is our SHARP study, already will start this year and 2024, 1,500 individuals. Of course, we have other areas that we are doing some research. We have AI-based drug. We have some clinical studies that we are doing, some checks for biological age clocks. Of course, basic science, we do have biobank sampling and interventional studies. So this is a platform that we all be happy to collaborate and do other research in different other basic science, interventional study, or AI with different hospitals. The third arm, as I mentioned, is our innovation lab. So our vision as innovation is joint venture with established and early stage companies for product development and clinical trials. We do have ARC. ARC in Sheba is Accelerated Redesign Healthcare. It's an organization inside Sheba that do collaborate with different companies, did some shared PI, some exit even, some patents, very well organized, and we are, of course, willing to and happy to collaborate with technology, we can be a beta site. We do have healthy individuals with a lot of data on them, and the areas will be big data, AI, product development, pharmaceutical drugs, and medical devices. So actually, in the last 3 years, we do have an extensive knowledge to be the longevity center in a public hospital. It will not happen without, of course, the help of Evelyn Bishop, that, first of all, amazing organization for this day, for Longevity Medicine Day. So thank you. And she was our advisor for the last 3 years that we were working on it, and happy to say that next week she's coming to Israel permanently, doing Aliyah, and will be the director of our Sheba Longevity Center. So thank you, Eva. And of course, we do always need to have a collaboration. It's one of the most important things, international collaboration. We do collaborate, of course, with Mayo Clinic and Singapore, which actually we are the only 3 hospitals nowadays that are opening longevity centers in a public hospital, and hopefully, there will be more. We do, as Sheba, we do also have collaboration with Hong Kong and Cleveland Clinic Abu Dhabi, and many, of course, to come, which is extremely important. So, happy and invite you all for our second SLCC in May, the conference that we will, of course, send more details about that, and you will be able to see our longevity department, first in a public hospital. So thank you very much.
Thank you so much, Tzipi, for this great presentation. And thank you for the kind words. We can take one question from the audience? All right.
Thank you so much.
Okay, it will be loud.
What was the primary outcome that you based your power calculation on?
What is the primary outcome to measure the power calculation on? For the clinical trial.
The outcome will be change in biological age and performance measurement. Yes, yes.
Clocks and functional performance and many others, yeah. So quite a bunch of objective measurements. Thank you so much. Wonderful. For more questions, Tzipi will be with us the whole week.